Good afternoon, and thank you for joining us today, and thank you for taking time. We're going to be talking about suicide prevention training for Indiana educators and your new legislation in Indiana for requiring the training of educators in suicide prevention. I'm Jennifer Spiegler. I'm the Senior Vice President for Strategic Partnerships here at Kognito, and I am honored and pleased to have with me Christopher Drapeau from Valparaiso, Indiana University. Before I hand it over to Chris, I want to go through a little bit of housekeeping because I know these questions always come up. Yes, this presentation will be recorded, and you will have a copy of the slides and the recording sent to you this afternoon. You are in listen-only mode. That means if you want to ask a question, look at your control panel on the right-hand side of your screen, and you can ask some questions. Right now, if you want to just try it out and see how it works, say hi and tell us where you're coming from today. Yeah, we're going to be here together for about 45 minutes. Chris is going to start us off and give us the backdrop of the legislation and give us a sense of where his subcommittee is in terms of approving programs for meeting the suicide prevention requirement, which did have, there is a little bit of confusion out there about that. So he's going to straighten us out. And then I'm going to walk you through a little bit about the work that we do here at Kognito around suicide prevention and how our programs could work in your district. So thank you again for coming and for being part of this event today. So Chris Drapeau is the committee chair of the Indiana Suicide Prevention Network's Education and Training Subcommittee. He is also an assistant professor of education at Valparaiso University. I believe, Chris, you are a clinical psychologist. Is that right?
Well, technically a school psychologist, but have a background in clinical and counseling psychology.
Great. Well, so with no further ado, I'm going to hand this over to you, and welcome.
All right. Thank you, Jennifer, and thank you, everyone, for being on the call. Really grateful to Kognito for letting us come and talk about some of the new legislation changes. If you could go to our first slide. So many of you may know about the House Enrolled Act 1430, which was this part of the bill that you're seeing here on the slide was put into place last summer, requiring all school corporations to adopt a suicide prevention policy. And these are some of the things that must be addressed by that policy. I'll review it really briefly because for some of you this may be a bit redundant, but as you can see there, counseling services for the child and the child's family related to suicide prevention. There needs to be availability of referral information for crisis intervention. Also, increasing awareness of the relationship between suicide and drug and alcohol use. Training on warning signs and tendencies that may evidence that child is considering suicide. Also, availability of information regarding suicide prevention services in the community. And that's something that I think was really emphasized in this part is that not only are schools, they no longer have to live on an island when it comes to school suicide prevention, but collaborating with the community and getting that linkage set up is an important part of this prevention policy. And then also having a plan to assist in the event that a student has non-fatally or fatally attempted suicide, and making sure that we have a response plan and supports for not only students but also school staff. And then, of course, development of any other program or activity that is appropriate. Next slide, please. And now the second part that I think many of the schools in Indiana are nervous about at this point is knowing how to meet this requirement that goes into effect on July 1st of this year, so very, very soon, a few weeks. And so this requires that evidence-based youth suicide awareness and prevention training is completed every 3 years for the following. The following are listed specifically in the law: all teachers, licensed superintendents, principal, librarian, school counselors, school psychologists, school nurses, school social workers, and then they also throw in any other appropriate school employees who are employed at schools with grades 5 through 12. So some have asked the question, well, this says all teachers, so is that all teachers? My understanding of the law based on our discussions with Indiana Suicide Prevention Network and with Jeff Whitman at Indiana Department of Education is this is only held to the 5th through 12th grade, but we also know that some schools in Indiana, 5th grade is within the elementary school, so if there's going to be a suicide prevention policy and we're going to have 5th grade teachers trained in suicide prevention, then it may not be a bad idea to train all of the teachers in suicide prevention as well. And we've also talked about encouraging this idea that suicide is not an individual failure, but a community failure, and that this approach kind of persuades us to think about training everybody within the school community in suicide prevention, because that way it kind of widens your safety net, and so there's more eyes on the students and more people who could intervene if a student is at risk. So it's not required that you train everyone in your school at this point, all school staff, but we strongly encourage it. Next slide, please. And this is another part of the second part of HEA 1430 that I know has caused a lot of headaches for some school employees, is that the training must be during the teachers or school employees' contracted day. And this is what's encouraging, I think, for including Kognito in the present and in the future, is that it doesn't all have to be in person, that there could be an online training that could be a part of this requirement of HEA 1430. I'll talk about a few slides later what training programs are currently approved and how we could look into approving others that may be of interest to you and your schools. So Senate Bill 230 was passed, and this is why. If you see this first bullet point at the top, says from HEA 1430. So originally we were going to include all suicide prevention training programs that were approved, recommended, or listed as approved by the Suicide Prevention Resource Center or SAMHSA's National Registry of Evidence-Based Programs and Practices. Well, unfortunately, the SPRC Best Practice Registry is no longer exists to my knowledge, and also funding has been cut for SAMHSA's NREP, the National Registry. So now that we have no entity with which to use for guidance on what programs to include and what not to regarding what's evidence-based and what isn't. So Senate Bill 230 was passed, and this, as you can see on the slide here, the second bullet point, it says it requires that teachers and other school employees receive at least 2 hours of research-based youth suicide awareness and prevention training from a program that is, number one, demonstrated to be an effective or promising program and recommended by the Indiana Suicide Prevention Network Advisory Council. So this was Indiana's way of trying to answer these now defunct registries that are no longer being used to determine what's evidence-based and what isn't. And so this is where the Education and Training Subcommittee comes in. Now we've been tasked with reviewing school suicide prevention training programs and determining which ones meet the requirements of HEA 1430. And these training programs will then be listed on the Indiana Department of Education website for suicide prevention awareness, and we'll be able to let all the schools know which training programs we recommend and approve as meeting the guidelines of HEA 1430. Now, here's where some confusion has come up. When there's a distinction between this bill and initial licensure for teachers. So there are more programs listed that teachers can take for their initial licensure, but those programs, not all of those programs have been approved thus far for this bill that we're discussing today. And if you have any questions, please reach out and let me know so we can help clarify any confusion that may exist. So here's our three. There's only 3 currently approved programs at the moment. The first is QPR, which is an in-person training, and the training must be 2 hours and must occur every 3 years. That's the mandate from HEA 1430. And there's usually we want a role-playing component with QPR, and typically this does occur. Also, applied suicide intervention skills training or ASSIST has been approved. This may be more difficult for teachers or school staff to complete because it's a 2-day full day training, in-person training, which is very difficult to schedule when you have a very tight school year schedule. And the third one that's been approved thus far is Kognito's 1 hour at risk for high school educators. And we recommend, because it's an hour and you're required to have 2 hours, that it's paired with a 1 hour in-person session that will focus on practicing gatekeeper skills and reviewing school policies and procedures. for suicide prevention. And so Colleen Carpenter and I, Colleen is a co-lead for the Indiana Suicide Prevention Network. We're both working together and creating a guidance document of what that should look like. And we're also coming up with a frequently asked questions document in case any questions may come up or any confusion. And we're hoping to get that and also the application process in case you want to pair up with a developer or perhaps there's a nonprofit in your community that wants to apply on your behalf for, let's say, Kognito's 2-hour trainings. You want to really use those in your schools. Well, we just need to review that as the Education and Training Subcommittee needs to review those programs to make sure that they meet the requirements of HA 1430. So we just need to have someone complete an application so that we can review all the materials and then make a decision and recommendation to the Indiana Suicide Prevention Network. But we're hoping to release can you go back one slide? Thank you. We're hoping to release the application review process and also the documents I referenced by the end of next week. So we're working fast and furious to try to get this information out as soon as possible. So why take youth suicide prevention seriously? I'm guessing if you're on this call, you already are very interested in doing so. But if you want to take some data back to your school, here's some data I compiled looking at suicides in Indiana from 1999 to 2016. So on the right, you see the bars showing the suicide rates for each age group. And then on the left, you see 2 boxes. And I want to point out the counties with the highest suicide rate for 15 to 19-year-olds. We have Porter, Marion, Lake County, St. Joseph County, Allen County have the 5 top suicide rates. And then for those aged 20 to 24 years, so seeing students or young adults who are a couple of years out, there are some counties that are in need of some help, for addressing youth suicide. So we have important work to do. There's a lot of work to do in several counties throughout Indiana, and so I hope you're excited to be a part of this process of reducing suicides in Indiana. Next slide, please. And then just to give you an idea, this slide was inspired by Colleen Carpenter. She likes to talk about the iceberg metaphor. If you look at the past year, in 2016, there were only 39 suicides for those high school aged youth in Indiana, so between the ages of 14 and 18, about 114 suicides among those 19 to 24. But really, that's just the tip of the iceberg, so to speak. We, based on the Youth Risk Behavior Survey in Indiana, based on the 2015 data, 1 in 10 high school students are reportedly non-fatally attempted suicide in the last year, and 1 in 5 reported that they had serious thoughts about attempting suicide. So if you just think about just high school in and of itself, you have maybe 25, 30 students in the classroom, and we're saying that 1 in every 5 is seriously thinking about suicide. So I share this data with you to consider, maybe take back to your schools if there's any resistance on implementing these suicide prevention policies and also programs, and would be happy to field any questions or if you're interested in further data. We do have a We do have a suicide prevention response resource guide and also a sample suicide prevention policy for Indiana schools that's available on the Department of Education's website. This was spearheaded by Dr. Brandy Oliver, who is in the school counseling program at Butler University. And she was, I was grateful just to assist her with this process, but we've created these documents that are available to you in your schools if you're interested. And the resource guide, if you go to the next slide, please, it'll give you a picture of where they're at. So if you can find this page with the prevention response and resources, then you can see the policies at the top there and then the resource guide. And I think I'm running short on time, so we can go to the next slide. So the purpose of the model policy, as you can see here, is just it's advocating for the school's role in fostering a positive climate, but it's also advocating for the need to form a crisis response team that can address the suicide policy and procedures in the school, and then creating this position of a suicide prevention coordinator, which it doesn't mandate that you have to hire a new person, but you can identify somebody who currently works at the school who has interest and expertise in suicide prevention who could fill this role. And then it's important that all school employees know their role in recognizing and responding to suicide risk. The resource guide, I just want to emphasize, I think one of the most important things in here, besides just knowing how to assess and manage suicide risk in students, is this idea of reentry. So typically the highest risk period for a youth suicide attempt or even adult suicide suicide attempt is following inpatient hospitalization. So it's important that we understand how to re-enter these students into school to address their risk and decrease the odds of a suicide attempt. So anyway, there's a lot of information here for you there, and I'll turn it over to Jennifer now.
Chris, thank you so much. And for anybody who's listening, I've got to say, Chris and Colleen are doing incredible work, which is, if I understand it correctly, unpaid work on the subcommittee. It's really a labor of love and a commitment to suicide prevention work and to saving lives in Indiana. So I have to just give a shout out and an extreme thanks to you and anybody on the committee for doing this work. It's really important. I can't express enough that how much in agreement we are with the policies and procedures, and hope that we do have a role to play here. With that, I do want to talk a little bit about Kognito and the way that our programs can help districts really not only check the box on this mandate, but really go above and beyond to help all educators and all adults in the school community be a part of suicide prevention. I can't agree more with what you said, Chris, about the safety net. We also hope everyone in the school community will participate. We actually base our pricing on a district-wide model that creates an unlimited use for our simulations for the district. That would mean not only certificated staff, teachers, administrators, and other professionals, but bus drivers, cafeteria workers, et cetera. So we're really very dedicated to that. And can agree with you more, too, that while the base rate, the number of 39 is not such a big number, it's huge for those communities and those families that lose a child, of course. But yes, in every school, you're looking at students who are at risk. 1 in 5 has a mental disorder that could be interfering with their success, not only in school but in life. So we really want to sensitize teachers and other school staff to that. A quick, can you go back 1 second, Maria? A little bit about Kognito. We're a health simulation company. We've been at this work for over a decade. We partner with schools to ensure that not only teachers are trained and all staff, we have programs for students as well. We have a growing portfolio, and not only for schools, but also for other professionals and community members. And we partner with a lot of very well-established health organizations, including the CDC, Robert Wood Johnson, and the American Academy of Pediatrics. Our simulation for high school educators is listed in NREP. Before NREP shut its doors for new applications, it did approve our elementary, middle, and high school versions in a new and higher level peer-reviewed process. They were approved for listing but didn't get listed, and if anybody wants to look at the evidence, I am happy to share those research papers with you. Just ask. We have trained close to 500,000 teachers in this country, all across the country, and including in many of your neighboring states. What we find is, and we do a lot of research, I'll talk a little bit about that in a minute, but from Sitka, Alaska to the Bronx, these simulations are very, very well received and effective for the users. So I'm going to quickly echo what Chris said about the role of teachers in suicide prevention. I would broaden that to student mental health in general. We're counting on our teachers to promote wellness, starting with the way they manage their classrooms and their personal relationships with students and families, building an environment for social and emotional wellness in the classroom, and really developing a trauma-sensitive communication style and support for school climate. Second, The teacher's role, identify emerging mental health issues. These teachers are the eyes and ears of mental health. The counselor is not in front of every kid. We know that teachers are in an ideal position to identify emerging mental health issues for students, changes in student behavior and appearance. They have a very privileged view of students' interactions with one another as well, because they see them every day. And I would say, as a parent, I think teachers might know my kid in some ways differently or better than I do. So thank you, teachers. Third, referral. The teacher has the relationship with the child. So creating the conditions for a warm handoff to mental health support, whether that's the school counselor, school psychologist, school social worker, or someone in the community, depending on the district and how they operate. And their ability to respond to a crisis, to know when there is really a student in crisis in their presence. And last, and Chris mentioned this too, the ongoing support. So a light touch or observation or check-ins with students where you've expressed concern, accommodating students who have been returned to the classroom after a hospitalization, for example, or an attempt. And then that continuous ongoing promotion of positive trauma-sensitive learning environment and school climate. So why aren't they doing that all the time? Well, it appears that there is a gap, and this is a slide I stole from my colleague Michael Long at George Washington University. His article about the effectiveness of our elementary school program will be coming out this fall in the Journal of School Health. But what Michael identified was that research on teacher preparedness has identified a lack of experience, training, and confidence to appropriately address mental health problems among students. And that in one study, teachers in communities with high levels of violence lack of training on mental health was cited as a key barrier to their success. And then I'm so excited to hear that Indiana has really embraced role play as part of the training regimen for teachers. We know that role play changes your brain. Role play is inherently important in activating new behaviors. And so that's where role play practice, we're trying to, here at Kognito, get teachers to do something different, not just to be aware of the potential for suicide among the students, but actually to take an active role. Face-to-face role play we're almost all familiar with. It has pros and cons. Yes, and role play has been identified in an article by suicide prevention researcher Wendy Cross as being really the secret sauce of face-to-face training. So learners learn to construct meaning and knowledge from their experiences. They are taking an active role in trying on a new behavior, a behavioral rehearsal, as Chris points out. And it gives you opportunities for feedback, and it's a safe practice environment, safe in that you're trying it out before you're trying it in real life. The downside of face-to-face role play is that a lot of people, when they engage in role play, feel uncomfortable. They're embarrassed. They feel like they're being judged by the other people in the room. So it's not necessarily the best way of learning something new. That social evaluative threat creates high cognitive load on the learner, and it can be an impedance to actually learning. In addition, when it's implemented, the fidelity to the model is variable. It depends on a human facilitator. That human facilitator may or may not be perfect. It also depends on if you're taking on the active role, who you're playing against. If I'm doing a role play with a practice role play with a student, how good is that student, and how good is the feedback that I'm being given? If we're doing it in a triad, which is often how role play is done in groups, that third person who's giving me a feedback is usually just another student. They're not an expert. So at Kognito, we attempted to solve some of these role play problems by creating simulated role play. Learners still construct meaning and knowledge from their experiences. They're doing versus telling. They're actively learning. But we give them an opportunity to learn from their mistakes. So instead of the social evaluative threat of being embarrassed when you do something wrong, you have the opportunity to get feedback from your virtual coach, who's always perfect, and you get to try things out, undo your decision, and try something else. It could be curiosity, or you could actually be making a mistake, and then it's just your mistake. So this is a truly safe practice environment for the learner. The low cognitive load increases the learning. And we are creating multiple levels of high quality feedback throughout the simulation. And it's a digital object, so there's 100% fidelity to the evidence-based model. I'm not going to talk about this because I don't have time, but I do want to show you how the Kognito simulations work. Instead of telling you, I will show you. This is Renee. Renee is a high school student. She has, we take on the role of a teacher named Mr. Lyons, and Mr. Lyons has heard from Renee's best friend that she suspects that Renee might be cutting. Now, our simulations have multiple conversations, multiple opportunities for the learner to learn the motivational interviewing skills that they would use with students, also self-regulation, emotional self-regulation, and awareness. So let me show you how the virtual conversation works.
What did you want to talk about?
I've been concerned about you lately. You seem a little stressed.
Oh, I don't know, maybe. Why?
Okay, so that's Mr. Lyons. He picked, you seemed a little stressed. He didn't want to break the ice. He knows Renee well. And now he has some feedback from his virtual coach. Good, expressing concern is a great place to start. Next, explain what's been noticed and to cause this concern. Decide which of the 3 topics you'd like to discuss in more depth. Now, I want to go back and talk about Renee's attitude, too. She's giving you feedback. So she was responsive, receptive. This was a good choice that Mr. Lyons made. Now, let's undo his choice and see how that might have gone in a different way. And you seem really nervous.
You seem really nervous lately.
No, I don't. I mean, what are you talking about?
So Renee is an emotionally responsive virtual human. She's coded to respond in a certain way to Mr. Lyons and his tactics. So here you're getting feedback not only from Renee, but from Jackie, your virtual coach. This is a broad criticism that's likely to make her defensive. A better approach is to gently express concern. That's what you did in the beginning. So you can see immediately that this is a highly interactive program. You cannot move forward unless you are making these choices. This is not a video. And then you can see that once you've made a choice and you've gone down a pathway, your choices will change. So now you can talk to her about grades, talk to her about the yearbook, or jump in and talk to her about cutting. So I don't want to spend too much time going through the simulation, and we will be happy to send anybody on the phone an evaluator link to look at any of the programs in our at-risk suite. At-risk is our flagship product. It has a version for elementary, middle, and high school. I would highly agree with Chris on the full spectrum training for districts. A lot of times districts want to train everybody using a single tool. This is a single tool, but differentiated for the grade level, which makes it even more relevant to learners. So you can see in that example, you were talking about to Renee, who's very, very anxious, but you'll also talk to 2 other students, Rob, who has poor attendance and low motivation, might be drug using, and Joey, who is a shy boy who's written about suicidal thoughts in an essay. And Joey is where your suicide prevention content is really going to be most explicit. In middle school, those are middle school appropriate conversations. In elementary school, you have a conversation with a child and a conversation with a mother. And that has been a very impactful conversation as well. Again, Chris mentioned community linkages. Part of that community is parents. The simulations not only support this mandate for suicide prevention training, but they fit with the tiered model that you may be using in your school or district to do prevention work, PBIS work, MTSS work, and other school climate work that you might be involved with. It really is underpins all of that work. So how do we know that these are impactful and effective? We've done a lot of research to show that the training has not only increases skills, confidence, and referral behaviors in national studies with thousands of users. We're going to look very quickly. You can see this is from our elementary school. This is data that's reported in Michael Long's article coming out in the Journal of School Health. Middle school, similarly, increases in the number of students we're concerned about, number of students that we approach to discuss our concerns, and some of those concerns might be alleviated. So an increase, but a little bit lower, in the number of students referred to support. And you can see this is a fairly high number of respondents that are matched pairs pre to post to follow up. In high school, same thing. Increase in number of students we're concerned about, increase in number of conversations we're having with students, and increase in referrals to support. Very, very high levels of appreciation and approval by educators. They rate the simulation very highly. They would recommend it highly to their colleagues. It's relevant to them. They say that it will aid them in getting timely help to their students. And the simulation is easy to use. Teachers sit in a lot of meetings, and this is an opportunity for them to work at their own pace and manage their own learning and, be part of a transformation of education that is going away from a lecture model to a much more self-paced, personalized learning model. For districts, what's really important here is the implementation support that Kognito provides. We give you tracking and usage data so on that self-paced side who has started and completed the training. We give you templates and materials. So we provide a discussion guide. So if you want to do 2 hours, we would give you slides to introduce the training. The gold standard would be that you would do this introduction with using data like Chris presented, maybe about your own community. You would have everybody go away and spend an hour doing the simulation and then come back together, use our discussion guide to debrief the staff and go through the policies and procedures that are part of the suicide prevention mandate for schools. So that gives you the opportunity, and it really sensitizes the learner, the teacher or staff person, about why this is such important information, and why do I care about these policies and procedures, and where do I fit? And now I have some skills that I can apply to be really part of the solution. And last, Chris mentioned community linkages. We have the perfect opportunity because for districts that adopt the simulations, we have a local resources customizable option. You can use that within the simulation. It's a link within the simulation experience itself that takes you to a page or a website with customizable local resources. So whatever those community resources that you as a district are engaging with, you can make sure that your users know that as well. And that gives them the confidence to know that when they do make a referral, that referral has much better chances of having an impact and being followed up on. There is a breadcrumb trail to help. So to access the simulations, it's very easy. You go, you use your laptop or desktop computer to go to our portal. You create an account. You select and launch the simulation. When you do that, you will register and affiliate yourself to whichever school in the district you work for, so that when we go and do reporting back to you, you can look at reporting at multiple levels. So you get usage data. If you're a district, if you're managing this at the district level, you can look at school by school user data. So you can say, oh, this school is doing great, and this school looks like they need a push. And so you can manage your own resources better. You can look at individual users. And if in a lot of cases we have statewide contracts. In Nebraska, we've trained every teacher using these programs. So, and the state, at the state level, that person has visibility on all the districts, all the schools, and all the individual users to know where the simulation is being followed up. In addition, as I mentioned, we have these templated materials. You don't have to be a suicide prevention expert to manage this with fidelity. And there's a discussion guide, there's talking points, there's PowerPoint slides. We're really trying to make this comfortable for the district to engage fully in suicide prevention and mental health promotion. And I mentioned the customizable local resources. This is what a very simple page would look like. At the end of the day, and we've implemented these simulations across all kinds of districts, large and small. Fairfax County, Virginia is, I think, in their 4th or 5th year of using our simulations. They were ground zero in Virginia and across the country for suicide prevention when they had a very bad suicide cluster. And they were adopted as part of that response. Laura Yeager, who's the Director of Partnerships and Resources for Fairfax County, which is the 10th largest school district in the nation, says people can walk away from the simulations feeling they have the intervention skills that can help save lives, and that's very powerful. So this is not the traditional e-learning that you're used to for compliance purposes, making everybody do every year, bloodborne pathogens or whatever else you're having them do. This is really, it's scalable, yes, but we give you everything you need to, from the solution itself to surveys to know how your users are responding. It's engaging. It really is based around skills, not just awareness. These skills are transferable to other difficult conversations teachers are having with students every single day, so they can be very supportive of other kinds of initiatives, problems that the teacher's encountering, not just mental health. And we're dedicated to your success, so our client experience team really makes sure that our implementation partners really know how to get this up and running and create a rollout plan that is seamless and effective. And the simulations have been proven to work to change teachers' behavior. So that's all I have to say. Let me just consult our question panel and see what questions have arisen. Chris, I have a question. Can you explain whether or not the Kognito 1 hour is on the approved list or not on the approved list?
Oh, yeah. So the 1 hour Kognito training for the at-risk high school educator training has been approved, is on the list. We just require that because it's 1 hour, you need 2 hour training. So we will come up with a guidance document on what the next hour should look like. And I failed to mention earlier that currently we're deliberating about the length of time in between those two trainings. So we have a timeline identified, but we need to approve that with the Indiana Suicide Prevention Network before we share that information about how long you can go between the two trainings.
Great. Thank you so much. A perennial question, and it has come up again today. How much does it cost to do the Kognito training? The training is based on headcount of teachers. So the overarching rule is the more people in the pool, the lower the cost per user. A single user is $32. That means nobody would pay more than that per user to access the training. It's a subscription service that you can access all year round. So another advantage that virtual role play has over face-to-face role play is you can go back and do it again. So once you have access, you have a full year to take the training, train, and or retrain. So let's see. Let's take one more question, and then I think we're at our time. How long does it take to set up Kognito training? We usually we get backed up in usually toward the beginning of the school year, but usually we can get clients set up with new implementations in about a week. Sometimes that stretches to 2. Shouldn't be longer than that. And I think that's all we have time for, and I think we're out of questions. So with that, I'm going to thank everybody for joining us today, and especially Chris, thank you so much. This has been super helpful. We're really grateful for you, not only for you joining us today, but for all the work you and your committee are doing there in Indiana. Thanks very much.
Appreciate it.
Bye now.
Have a good day.